සුබ දවසක් ඔය හැමෝටම. අපි අද කතා කරන්න යන්නේ ෆාමසි එක්ස්ටර්නල් කෝස් පේපර් ඩිස්කෂන් එකේ 15 වෙනි පේපර් එකේ. ඔයාලට මොන හරි ගැටලුවක් තිබුණොත් ඒ WhatsApp ලින්ක් එකෙන් 077 18 46 911 077 18 46 911. ඒ වගේම channel එක subscribe කරන්න කියලා ආරාධනා කරනවා. like කරන්න, comment කරන්න. අපි යමු පේපර් එකට. පළවෙනි එක කියනවා true or false regarding penicillin. Phenoxymethyl penicillin is administered on empty stomach to minimize the bad gastric irritation caused by it. False. B එක කියනවා benzethine penicillin is given every 21 to 26 days to prevent rheumatic fever in patients with rheumatic heart disease. True. Erythromycin is contraindicated in patients who are hypersensitive to penicillin. False. Cloxacillin is indicated for staphylococcal infection. True. Amoxicillin is better absorbed from the bowel than ampicillin. True. දෙවැනි එක කියනවා true or false about penicillin. A. Benzyl penicillin is classified as broad spectrum penicillin. False. A. Amoxicillin is known to cause diarrhea in children. True. C. Phenoxymethyl penicillin is recommended to be taken after meals. False. D. Cephalexin belongs to family of drugs called penicillin. False. Cloxacillin is stable against common staphylococcal beta lactamases. True. තුන්වෙනි එක benzyl penicillin has a narrow spectrum antibacterial activity. True. Phenoxymethyl penicillin is recommended for gastroenteritis in children. True. C. Cloxacillin is ineffective in staphylococcal skin infection. False. Cefuroxime is an oral cephalosporin. False. Cephalexin is third generation cephalosporin. True. True or false about beta-lactam antimicrobials. A. Benzyl penicillin is recommended to be used parenterally. False. Phenoxymethyl penicillin is contraindicated in children. False. Cefuroxime is a parenteral cephalosporin. False. Clavulanic acid inhibits beta-lactamase enzyme. True. Amoxicillin is broad-spectrum penicillin. True. Amoxicillin is not inactivated by beta-lactamases. False. Is excreted by kidneys. True. Is highly active in most cases of urinary tract infection in Sri Lanka. True. Induced skin rashes do not appear after stopping it. True. Absorption is significantly affected by food intake. True. Amoxicillin has low bioavailability if administered with meals. False. Is combined with clavulanic acid to destroy beta-lactamase enzymes. True. Is suitable for patients who exhibit IgE mediated allergy. Benzyl penicillin. False. Reconstituted suspension is stable for 2 weeks. False. Is effective in the treatment of viral pharyngitis. False. Antibiotics. Antibiotics. Chemical substances obtained from one type one type of microorganisms organisms which is which is used to used to destroy destroy another type of another type of type of microorganism organism. So the mechanism of antibiotics. Mechanism of antibiotics. Mechanism of mechanism of mechanism of antibiotics. Antibiotics. Inhibit cell wall synthesis. Cell wall synthesis. Inhibit nucleic acid synthesis. Inhibit protein synthesis. Antimicrobial spectrum. Antimicrobial spectrum. Antimicrobial spectrum. Narrow spectrum. Broad spectrum. Narrow spectrum. Narrow spectrum. This drug destroy limited number of bacteria. Broad spectrum. Broad spectrum. These drug are destroy large number of bacteria. Terima kasih banyak. Uses of uses of antibiotics. Antibiotics. Biotics. Scientifically. Scientifically. Prescribe. 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 Antibiotic. Antibiotic. After. After. Proper. Proper. Diagnosis. Diagnosis. Select the correct doses. Correct doses. Select the correct route. Use an correct dose interval. Interval. For required duration. Maximum 5 days. Maximum 5 days. Reasons for combination of antibiotics. Combination of antibiotics. Antibiotics. 2 avoid development of resistant to provide broad coverage in microbial infection. Severe infection can occur. Unidentification. A pathogen cannot be easily killed. Prevention of emergency resistant tuberculosis. Main group of antibiotics. Main group of main main group of antibiotics. Antibiotics. Penicillin. Penicillin. Cephalosporins. Cephalosporins. Sporins. Aminoglycosides. Aminoglycosides. Macrolides. Macrolides. Quinolones. Quinolones. Sulfonamide. Sulfonamide. Tetracyclines. Tetracyclines. It was long. Beta-lactam antibiotics. Beta-lactam. Beta-lactam antibiotics. Antibiotics. Beta-lactam gatto. Penicillin. Penicillin. Cephalosporins. Cephalosporins. Monobactam. 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 Carbamazepine. Carbamazepine. तो सब गरम पेनिसिलिन. Penicillin. 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 Natural penicillin. Natural penicillin. Penicillin. Semi-synthetic. Semi-synthetic. Penicillin. Penicillin. Penicillinase resistant. Penicillinase. Penicillinase. Resistant penicillin. Resistant penicillin. It was anti-pseudomonal penicillin. Anti-pseudomonal penicillin. Miscellaneous penicillin. Miscellaneous penicillin. This is one of natural penicillin. Natural penicillin. Natural penicillin. Natural penicillin. Penicillin. Penicillin G. Penicillin G. Penicillin. Penicillin G. तो अब यहाँ बेंसाइल पेनिसिलिन. Procaine penicillin. Procaine penicillin. Benzathine penicillin. Benzathine penicillin. Phenoxymethyl penicillin. Phenoxymethyl penicillin. Penicillin. It was a semi-synthetic. Semi-synthetic. Semi-synthetic penicillin. Penicillin. Ampicillin. 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 Amoxicillin. It was penicillin is resistant penicillin. Penicillin is resistant penicillin. Cloxacillin. 2-cloxacillin. Possible. Anti-pseudomonal penicillin. Anti-pseudomonal penicillin. Piperacillin. Ticagrelor. Miscellaneous penicillin. Miscellaneous penicillin. Chaomycin. Mode of action. Mode of action. Penicillin antibiotic. Inhibit cell wall synthesis. Peptidoglycan. Substances. Need for forming cell wall synthesis. These drugs inactivated, inactivated. This peptidoglycan, this peptidoglycan, glycan. Cephalosporins, first generation cephaloxime cephridine, second generation cefuroxime cefactor, third generation cefixime cefotaxime, fourth generation cefepime. Aminoglycosides, amino aminoglycosides, aminoglycosides. Bacterial effect, bacterial effect. These bind to, these bind to ribosome and form abnormal proteins. This drug, this drug group toxic. Compare with other class. Other class. First amino glycoside is streptomycin. It is against gram positive and gram negative bacteria. It is given by injection. Injection. It was available inhibitors of protein synthesis. Macrolides. Example තමයි erythromycin, azithromycin, clarithromycin, procithromycin. This drug group have bactericidal and bactericidal and bacteriostatic. Bacterio bacteriostatic action. Static action. This drug live enzyme inhibitor drugs metabolized by live excreted in bile Terus ya. It also cross placenta barrier secreted in breast milk not contraindication in pregnancy and lactation penicillin allergic patient can given this drug to rositro has the lowest side effect than erythromycin. හරි අපි අද කතා කරේ මේක ඩිස්කෂන් එකේ 15 වෙනි පේපර් එකේ 15 වෙනි පේපර් එකේ ඒකට ඔයාලට මොනවා හරි අපහැදිලි අපහැදිලියක් තියෙනවා ප්‍රශ්න තියෙනවා මට WhatsApp message එකක් දාන්න 077 18යි 46යි 911 077 18යි 46යි 911 ඒ වගේම channel එකත් subscribe කරන්න කියලා ආරාධනා කරනවා subscribe like කරන්න comment කරන්න හැමෝටම සුබ දවසක් අපි ඊළඟ පේපර් එකෙන් හමු වෙමු